The operating room had already fallen silent once before the alarm screamed again, and everyone inside knew silence like that usually meant someone had lost the fight. A stainless steel instrument struck the floor with a sharp metallic ring that echoed through the room, as though the hospital itself had flinched. The patient lying beneath the bright surgical lights was only 34 years old, his chest open, his blood pressure collapsing faster than the machines could report it, while the most experienced surgeons in the building stared at the exposed field with the terrible expression of people realizing knowledge alone might not be enough. No one noticed the youngest doctor in the room tightening her gloves one last time, because no one had expected her to matter. Her name was Dr. Emily Carter, 27 years old, barely 6 months into her surgical residency. Standing beside a tray of instruments she had organized with almost obsessive precision. She was there to assist, to observe, to follow instructions, nothing more. That was what everyone believed. The operating theater belonged to giants, physicians whose names appeared in medical journals and conference lectures across the world. Emily's name appeared only on resident schedules that changed every week. She knew her place. At least she had been taught to believe she did. Outside the operating room, another trauma alert echoed through the emergency department, but inside there was only one life that mattered. The patient had suffered catastrophic internal injuries after a highway collision involving a fuel tanker, and every second since his arrival had been a race against blood loss. 2 senior attending surgeons had already disagreed over the best approach before the operation even began. Their argument had continued through the first hour of surgery, each correction sharper than the last, until the atmosphere itself felt heavier than the lead aprons hanging on the wall. The scrubbed nurse exchanged anxious glances with the anesthesiologist while pretending not to notice the growing tension. Hospitals had their own language, and silence often spoke louder than words. Emily watched everything. She always did. Her mentor during medical school had once told her that the difference between a good surgeon and a great one was rarely intelligence. It was attention. Most mistakes announced themselves quietly before they became disasters. Listen long enough, he had said, and the human body whispers before it screams. Those words had never left her. They lived inside every careful movement she made. She counted instruments twice even when protocol required only one count. She checked monitor trends instead of isolated numbers. She noticed hands that trembled before voices did. Most people called it overthinking. Her mentor had called it respect. Across the operating table, Dr. Victor Langley, the hospital's celebrated cardiovascular specialist, leaned closer to the wound and frowned. "This isn't making sense," he muttered. "We should already have control." Another attending suggested clamping a different vessel. A third recommended closing before more damage could occur. Each opinion collided with the next until the operation became a battlefield of experience rather than cooperation. Emily felt her pulse quicken. Something was wrong, but not in the way everyone assumed. Her eyes drifted toward the monitor displaying oxygen saturation, then toward the patient's skin tone, then to a nearly invisible change in the color of blood pooling beneath the retractors. It was subtle, almost impossible to notice unless someone had been watching continuously for the last 15 minutes. She swallowed. "Doctor," she began carefully. No one answered. Dr. Langley extended a hand without looking. "Scalpel." Emily placed it into his palm automatically, then tried again. "Doctor, I think." "Hold your thoughts until we're finished," someone interrupted, without even turning around. The words landed harder than intended, though perhaps not harder than usual. Residents learned quickly that timing mattered. Emily lowered her eyes. Around her, the room accelerated. More suction. More sponges. Another unit of blood. The anesthesiologist announced falling pressure. A circulating nurse sprinted toward the storage cabinet. Every movement became faster, louder, desperate. Emily remained still. She remembered another lesson from years earlier. Panic narrows vision. Calm expands it. She forced herself to breathe slowly, despite the storm unfolding around her. Her gaze returned to the exposed anatomy. There. Again. The pattern repeated. Blood entered the field differently, with each heartbeat. Not random. Rhythmic. Predictable. Her mentor had shown her something similar once during an old training video recorded decades earlier. Everyone else in the classroom had focused on the dramatic injury. Emily had watched the shadows around it instead. She could almost hear his voice now. Never chase the loudest problem first. The quiet one usually causes it. Her hands tightened around the edge of the instrument table. She knew what she was seeing, or at least she believed she did. But belief carried little weight against surgeons with 30 years of experience. She looked toward the scrubbed nurse, Margaret, whose silver hair escaped slightly beneath her surgical cap. Margaret noticed Emily's expression and held her gaze for only a fraction of a second. It was enough. The older nurse had spent 4 decades inside operating rooms. She had seen confidence destroy patients and humility save them. Without speaking, she followed Emily's eyes toward the operative field. A flicker of realization crossed Margaret's face before disappearing behind professional composure. She leaned toward Dr. Langley. "Doctor, the resident may have noticed something." "Not now, Margaret. We don't have time." Emily looked away, embarrassed for both of them. She told herself to remain silent. Residents who challenged attendings earned reputations that followed them for years. One mistake could end careers before they truly began. Yet the patient on the table had no years left to lose. The monitor emitted another piercing tone. Blood pressure crashed again. The anesthesiologist's voice sharpened. "We're losing him." Every conversation stopped. Every pair of eyes locked onto the monitors. For 2 endless seconds no one moved. The room became unnaturally still. Emily heard only her own breathing inside the mask. Then she stepped forward. Not boldly, not dramatically, just one careful step. "Doctor, the bleeding isn't the primary problem. I think the tear is lower than it appears. You're repairing the consequence, not the source." Several heads turned toward her as though they had forgotten she was even there. Dr. Langley stared at the resident with disbelief, irritation, and exhaustion mixing across his face. Before he could respond, the operating room doors burst open. The hospital's chief surgeon entered with urgent strides, his eyes immediately taking in the chaos surrounding the table. He looked at the failing monitors, the exhausted team, the open chest, and the frozen expressions on every face before asking the single question that made every heartbeat in the room seem to stop. Who's actually in control of this surgery? The question hung over the operating room with a weight that seemed to press against every masked face. No one answered immediately. The steady rhythm of the heart monitor had become uneven. The patient's blood pressure continued to fall, and every second of hesitation carried the cost of another heartbeat slipping away. Chief Surgeon Daniel Whitmore surveyed the room with the practiced eyes of a man who had spent 3 decades making impossible decisions under impossible pressure. He did not need anyone to explain that something had gone terribly wrong. The scattered instruments, the exhausted expressions, and the silence among surgeons told him more than any report could. Dr. Victor Langley finally straightened, removing one blood-stained glove before speaking. "We encountered complications beyond the initial trauma. We're managing them." Whitmore's gaze shifted from the wound to the monitors, and then to the faces surrounding the table. "Managing them?" he asked quietly. "It doesn't look like anyone is managing anything." The words landed without anger. Somehow that made them heavier. Emily remained near the instrument table, her heart pounding so loudly she could barely hear the machines around her. Every instinct told her to disappear into the background again. Residents survived by observing, not by becoming part of conflicts between senior physicians. But the image before her refused to leave her mind. The unusual flow of blood, the subtle discoloration, the rhythm that didn't belong. She knew she had seen it before, years earlier. During an archived surgical demonstration, almost no one in her class had bothered to finish watching. Most had dismissed the grainy recording as outdated. Emily had watched it 3 times. Chief Whitmore leaned over the patient without touching the field. "What have we missed?" he asked. No one answered. Every surgeon seemed trapped between uncertainty and pride. Then Margaret, the veteran scrub nurse whose calm had steadied generations of operating rooms, spoke with measured confidence. "Doctor, the resident believes the injury extends deeper than we've been treating." Several heads turned toward Emily again. This time there was no irritation in Whitmore's eyes, only curiosity. "You saw something." Emily hesitated. She felt every gaze settle on her shoulders like additional weight. "I might be wrong," she admitted. but the bleeding pattern doesn't match the vessel everyone's repairing. The pressure drops before each visible surge. I think there's a concealed tear beneath the diaphragm, partially hidden by the surrounding tissue. If that's true, closing this area won't stop anything. For a long moment nobody moved. Langley exhaled through clenched teeth. With respect, Chief. She's a first-year resident interpreting trauma anatomy beyond her experience. Whitmore never looked away from Emily. Why do you believe it? Emily swallowed. Because the blood is changing color before it reaches the field. Because the suction canisters are filling too slowly for this amount of pressure loss. And because she paused, remembering a detail almost too small to mention. Because the retractor shifted 3 millimeters on the last heartbeat and exposed a pulse that shouldn't exist there. The operating room fell completely silent. Margaret slowly looked toward the exact location Emily had described. So did Whitmore. Even Langley frowned despite himself. Another heartbeat passed. Then another. Whitmore extended his hand toward the retractor. Lift it. The assistant adjusted it only slightly. At first nothing appeared different. Then, beneath a thin layer of damaged tissue, a narrow stream of dark blood pulsed, exactly where Emily had predicted. Every face around the table changed at once. There it is, the anesthesiologist whispered. Langley's expression hardened into disbelief. Impossible. Whitmore's voice remained calm. No, just overlooked. The room instantly transformed. Orders came rapidly but without panic. Suction repositioned. Additional clamps requested. New exposure established. Every movement now followed the hidden injury instead of the obvious one. Emily stepped backward again, expecting someone else to take over completely now that the source had been identified. Instead, Whitmore looked directly at her. Stay where you are. If you noticed that once, you may notice something again before the rest of us. The words stunned her more than anyone else. For the first time since entering residency, someone had invited her to think instead of merely obey. The operation continued. Minutes stretched into what felt like hours. Slowly the bleeding began to decrease. Blood pressure climbed one cautious number at a time. Hope returned, fragile but unmistakable. No one celebrated. Experienced surgical teams knew better than to celebrate too early. Then another problem emerged. The patient's heart suddenly developed an irregular rhythm unlike anything seen since the operation began. The monitor sounded a warning that cut through the room. Emily watched the waveform carefully. Something about it seemed familiar. She closed her eyes for the briefest moment, searching her memory. Then she remembered the final section of that forgotten teaching film. Her mentor had paused the recording at almost this exact moment. Everyone else had packed their bags and left the classroom. Only Emily had remained seated. Her mentor had smiled and said, "Someday this part will matter more than the operation itself." She opened her eyes. "Doctor," she said softly. Whitmore looked toward her immediately. If the concealed tear compressed the surrounding tissue this long, restoring blood flow too quickly could trigger electrical instability. We may need to release pressure gradually instead of all at once. Langley looked unconvinced, but Whitmore asked only one question. "Have you seen this happen?" "Not in person," Emily admitted, "but I studied a historical case almost identical to this one." The room became still again. Whitmore considered her words for only a second before nodding. "We slow the restoration. Adjust accordingly." The team obeyed. Every movement became smaller, more deliberate, less aggressive. The irregular rhythm stabilized. One warning tone disappeared. Then another. The monitor slowly settled into a steadier pattern. A collective breath escaped the room almost unnoticed. Nearly 40 minutes later, the impossible operation reached a point no one had expected to see. The patient's heart continued beating on its own. Blood pressure held. Oxygen levels climbed steadily. It was not victory yet, but survival had returned to the realm of possibility. As the final repair was completed, Whitmore quietly removed his gloves and looked around the operating room. His eyes rested on Emily for only a moment before shifting toward Margaret. "After this patient reaches intensive care, I want every operative note, every instrument log, every anesthesia record, and every camera recording from this room. Something extraordinary happened here today." Langley looked puzzled. "Chief, the cameras malfunctioned about 20 minutes into the procedure. They stopped recording." Whitmore frowned. "Every one of them?" Margaret answered quietly. Yes, doctor. They all went dark at exactly the same time. Whitmore looked back toward the patient whose life had somehow been pulled back from the edge. Then he spoke almost to himself. If the cameras missed the most important minutes, how are we ever going to know who truly finished the impossible surgery? Morning arrived without bringing certainty. The intensive care unit was quieter than usual, yet the silence carried an unmistakable current of curiosity. Word had spread through the hospital overnight that a patient expected to die had survived one of the most complex trauma surgeries anyone could remember. By breakfast, every department had heard a different version of the story. Some insisted Chief Surgeon Daniel Whitmore had performed a miracle. Others claimed Dr. Victor Langley had executed an experimental technique no textbook described. A few whispered that luck alone had intervened. Almost no one mentioned the junior resident standing quietly against the operating room wall, because almost no one knew she had mattered. Emily Carter preferred it that way. She walked through the corridors, carrying fresh patient charts, with the same measured pace she used every morning, greeting nurses by name, thanking housekeeping staff who polished the floors before sunrise, and checking overnight laboratory results before anyone asked. The previous night's events replayed endlessly in her mind, but she refused to linger on them. The patient was alive. That was enough. Recognition had never been the reason she entered medicine. Her mentor had once told her that applause faded faster than gratitude. Save your energy for the patient, not the audience. She had never forgotten those words. Chief Whitmore, however, could not let the matter rest. Before noon, he assembled the entire surgical team inside the hospital's clinical review room. Operative records covered the conference table. Enlarged imaging scans glowed across digital monitors. The anesthesia timeline had been printed minute by minute. Even the discarded surgical instruments had been photographed before sterilization. Whitmore rarely ordered such exhaustive reviews unless he believed something larger than an individual case was at stake. This wasn't about assigning blame. It was about understanding how a patient everyone expected to lose had survived against overwhelming odds. The meeting began with facts, vital signs, blood loss, medication doses, surgical interventions. Every step was reconstructed with relentless precision. Yet one gap remained impossible to explain. The operating room cameras had failed during the exact 27 minutes when the decisive corrections occurred. Engineers confirmed no electrical fault. Information technology staff found no evidence of tampering. The recordings simply stopped. They resumed only after the patient had stabilized. The most important part of the operation existed only in human memory. Human memory, Whitmore knew, was imperfect, especially under pressure. Each surgeon described events differently. One believed the hidden tear had been located after routine exploration. Another insisted the correction happened almost accidentally. Langley described a sequence of decisions that sounded convincing until Margaret quietly pointed out several inconsistencies between his recollection and the instrument log. Nobody accused him of dishonesty. Stress distorted memory. That much was well understood. But the contradictions continued accumulating. A vascular clamp had been requested before anyone claimed to recognize the concealed injury. An uncommon suture material appeared on the tray minutes before the official decision to change techniques. The timeline refused to fit the explanations being offered. Then Margaret placed a small folded piece of paper onto the conference table. "I found this in the operating room after everyone left," she said softly. Emily immediately recognized it. Her heart skipped. It was one page torn from an old notebook, edges worn smooth from years of handling. On it were several hand-drawn anatomical sketches, and a single sentence written in faded blue ink. "Look where others stop looking." Whitmore stared at the handwriting for several long seconds. His expression changed almost imperceptibly. Where did this come from? Margaret looked toward Emily, but did not answer for her. Whitmore followed her eyes. Emily hesitated. The room suddenly felt much smaller. "It belonged to my mentor," she said quietly. "He gave it to me during medical school. I keep it inside my surgical handbook. It must have slipped out during the operation." Whitmore picked up the page carefully, as though it were far more valuable than ordinary paper. His voice grew unexpectedly gentle. "Who was your mentor?" Emily answered with quiet respect. "Dr. Samuel Bennett." The room became completely still. Several senior physicians exchanged confused looks, but Whitmore remained motionless. Samuel Bennett, he repeated almost in a whisper. I haven't heard that name in 20 years. Langley frowned. The retired trauma surgeon? Whitmore nodded slowly. More than retired. Forgotten. Most of the younger staff had never heard of Bennett. Decades earlier, he had been considered one of the finest trauma surgeons in the country. Famous not for dramatic innovations, but for extraordinary observation. His operations rarely appeared spectacular because he prevented disasters before anyone else recognized they existed. Then, after losing his wife to an illness he could not cure, he quietly disappeared from academic medicine. His lectures stopped. His publications ended. Eventually, his name faded from conference halls and training programs. Only older surgeons remembered him. Whitmore leaned back in his chair, eyes fixed on the notebook page. Do you know why Bennett never became department chair? Emily shook her head. Because he kept promoting residents who challenged him. Administration hated it. He believed hierarchy should never silence good judgment. Whitmore smiled sadly. We argued constantly. I thought experience deserved the final word. Bennett insisted evidence did. We stopped speaking shortly before he retired. Silence settled over the room. No one interrupted. Finally, Whitmore looked directly at Emily. Did he teach you the decompression sequence you suggested yesterday? She nodded. Years ago. He said trauma fool surgeons into chasing what looks dangerous instead of what truly is. Whitmore closed his eyes briefly. Samuel used to tell me exactly the same thing. Across the table, Langley lowered his gaze. The confidence he had carried throughout the meeting began to dissolve. I dismissed her twice. He admitted quietly. Maybe 3 times. I heard her speaking, but I never really listened. No one criticized him. They didn't need to. His own words carried enough weight. Emily looked toward the window rather than at anyone else. She had not wanted this conversation. She had never intended to become part of the story. After a long silence, Whitmore asked the question only she could answer. When did you realize the operation could still be saved? Emily took a slow breath. Honestly, before anyone else believed it could. Because the patient wasn't telling us he was dying. His body was telling us exactly how to save him. We just weren't hearing it. The room remained silent for several seconds. Even the air conditioning seemed to disappear beneath the weight of her words. Then Margaret quietly slid another document across the table. It was the finalized operative timeline she had reconstructed from handwritten nursing notes taken every minute during surgery. Whitmore scanned the page, stopping halfway down. His expression shifted from curiosity to astonishment. According to the timestamps, nearly every life-saving correction had been initiated within seconds of observations first spoken by Emily, long before any attending surgeon formally acknowledged them. The official report credited the entire surgical team equally, but the handwritten notes told a more honest story. Whitmore looked around the room at every physician present before speaking with quiet conviction. Yesterday, we thought we saved a patient through experience. Today, I believe experience survived because someone with the courage to speak refused to surrender to silence. And for the first time since the impossible operation began, every person in the room understood that the greatest act of surgery had not been performed by the most famous hands, but by the quiet voice everyone had almost ignored. 3 days later, sunlight filtered through the tall windows of the surgical intensive care unit, washing the polished floors in soft gold as though the hospital itself had decided to breathe a little easier. The patient who had arrived with almost no chance of survival opened his eyes for the first time since the operation. His breathing was steady. His heart beat with quiet confidence. The room filled not with celebration but with relief, the kind that settled gently into tired shoulders after carrying impossible weight. Nurses smiled without saying much. The respiratory therapist adjusted a monitor with careful hands. Even the machine seemed less urgent now. Outside the room, families passed through the corridor unaware that they were walking beside a miracle built not from luck, but from countless moments of observation, humility, and courage. Chief Surgeon Daniel Whitmore stood at the glass window watching the patient for several seconds before turning toward the conference hall where the hospital's weekly surgical review was about to begin. Every attending surgeon, resident, nurse, and medical student had been asked to attend. Rumors spread quickly through the hospital. Some expected awards. Others expected disciplinary action. No one knew what Whitmore intended to say. Emily Carter entered quietly and took a seat near the back, hoping once again to disappear into the crowd. That had always been easier. Recognition carried expectations she never wanted. She believed the patient deserved the attention, not the people who had treated him. Margaret noticed where Emily had chosen to sit and smiled to herself without saying anything. Some people never stopped choosing humility, even after the world finally noticed them. Whitmore stepped to the front of the room, carrying nothing except a thin folder. He looked across the audience for a long moment before speaking. For 32 years, I believed experience was the strongest instrument inside an operating room. Last week proved I was wrong. A quiet murmur moved through the room. Whitmore continued. Experience matters. Skill matters. Training matters. But none of them matter if pride prevents us from hearing the truth when it comes from unexpected places. He paused, allowing the silence to settle naturally. It was not an uncomfortable silence. It was reflective, almost reverent. Every person in the room understood they were witnessing something rare. Hospital leaders seldom admitted their own failures publicly. Whitmore opened the folder and removed the reconstructed timeline from the surgery. He did not read every detail. He did not need to. Instead, he spoke from memory. During the operation, several life-saving observations were made before they were accepted. Those observations came from the most junior physician in the room. They were questioned because of rank rather than evidence. Had we continued ignoring them, our patient would not be alive today. No one looked at Emily immediately. Somehow that felt respectful. The room remained focused on Whitmore, who then did something no one expected. He stepped away from the podium, walked through the audience, and stopped beside Emily's chair. "You should be sitting in the front," he said gently. Emily looked up, visibly uncomfortable. "I don't think so, sir." He smiled. Samuel Bennett would probably say exactly the same thing. A faint laugh spread across the room, breaking the tension for the first time all morning. Emily reluctantly stood as Whitmore invited her forward. She walked slowly, wishing the distance were shorter. She had imagined countless difficult moments during residency. But standing before the entire surgical department, while everyone applauded, had never been one of them. When the applause finally faded, Whitmore addressed the audience once more. "Some of you believe this meeting is about recognizing extraordinary talent. It isn't. Extraordinary talent exists in every generation. The real question is whether those in positions of authority are humble enough to recognize it before it is too late." Dr. Victor Langley rose from his seat without being asked. The room grew quiet again. He faced Emily directly. In front of colleagues who had admired him for decades, he removed the silver pin that identified him as head of trauma surgery and placed it gently on the podium. Then he spoke with complete honesty. "I owe you an apology. I heard your voice and measured it against your title instead of your judgment. I nearly made the greatest mistake of my career because I confused seniority with certainty." Emily shook her head softly. "You don't owe me anything. The patient survived. That's what matters." Langley smiled sadly. "That's exactly why I owe you everything." The sincerity in his voice left no room for pride. Margaret quietly wiped away a tear. She had spent 40 years watching brilliant people learn difficult lessons. Few learned them with such grace. The meeting ended, but the story did not. In the weeks that followed, changes spread throughout the hospital. Surgical briefings were redesigned so every member of the operating team, regardless of position, would be asked directly if they had concerns before critical decisions were made. Residents were encouraged not merely to observe, but to question respectfully whenever evidence demanded it. Nurses gained a stronger voice during operations because their experience often revealed details others overlooked. The new protocol became known simply as the Bennett Pause, honoring the forgotten surgeon whose greatest lesson had finally found its way home. Whitmore personally visited Dr. Samuel Bennett, now an elderly man, living quietly outside the city. Their conversation lasted nearly 4 hours. No reporters attended. No photographs were taken. When Whitmore returned, he carried only one sentence Bennett had asked him to remember. "Pass the courage forward." It became engraved on a small plaque outside the hospital's main operating suite. Months later, the patient returned for a routine follow-up appointment carrying his young daughter by the hand. He had no memory of the operation itself. He remembered only waking to discover he had been given another chance to watch his child grow up. He thanked every member of the medical team individually, never realizing how close the world had come to losing him. Before leaving, he handed Emily a simple folded note. Inside were just a few handwritten words. "My daughter still has a father because someone refused to stay silent." Emily folded the note carefully and placed it inside the same worn surgical handbook where Samuel Bennett's faded page had rested for years. 2 pieces of paper, 2 quiet reminders that wisdom often traveled in the smallest forms. That evening, as the sun dipped below the hospital skyline, Emily stood for a moment outside the operating rooms before beginning another overnight shift. New emergencies were already arriving. New lives would soon depend on calm hands and clear minds. Nothing about medicine had become easier, but something important had changed. People listened differently now. Titles still existed. Experience was still respected. Yet somewhere between authority and humility, a new culture had begun to take root. One where questions were welcomed before certainty, where observation mattered as much as reputation, and where the quietest voice in the room was never ignored simply because it spoke softly. The strongest hands in an operating room are often the ones no one thinks to watch. That truth echoed far beyond the walls of the hospital because it was never only about surgery. It was about every place where dignity competes with ego, where courage speaks without raising its voice, and where one person chooses to do what is right even when no one expects them to matter. Some heroes leave their names on buildings. Others leave them in the lives that continue because they cared enough to notice what everyone else overlooked. If this story stayed with you, share it with someone who believes kindness is weakness or that quiet people cannot change the world. Sometimes the greatest miracles begin with a voice almost no one hears, until it becomes the reason someone else gets to live.